Hi again, this is Dr. Fredda Rosenbaum. Happy to see you back with me. Today we wanted to talk a little bit about periodontal disease, gum disease, gingivitis, all those things, bleeding gums, nasty smell, sometimes really nasty smell. Gum disease is a bacterial infection, basically. It is a bacterial process, and the only person who can take care of this is you. You're it. You're the one. And so we really inspire our patients to take care of their mouths. We inspire them to get rid of the bacteria in there. We have patients who come in, for example, this is one genotype probably, they have no decay in their mouth. They have absolutely perfect teeth. They have never had a cavity in their mouths. It's a different bacteria. One causes decay, one causes gum disease. They have a preponderance of the kind that causes gum disease. And they, in their 30s and 40s, it can take off like wildfire, and all of a sudden the bone gets dissolved around their teeth. It gets eaten away. And it's from the bacterial process that's in there. And so the gum bleeding is a sign that something is happening. It's not a sign that you're brushing too hard or flossing too hard. It's a sign that there's a bacterial irritating your tissue. And it has actually ulcerated underneath. And when you floss and you're bleeding, your gums underneath have always been irritated and aggravated and unhappy. The more you floss, the less they bleed. And so that's one of those misnomers that people think, well, if I floss too much, it bleeds a lot. If I don't floss, it doesn't bleed. It's still bleeding and it's still infected. And so you want to upset the balance in your mouth when that's happening. You want to make them as uncomfortable as you can. They have set up housekeeping in your mouth. They've sold real estate. They have moved in and they're happy living in there. And you want to make them unhappy. And so one of the things we use, first of all, we all floss. So we use FBI as a way to remember it, floss, brush, irrigate. We floss first, and you want to get under the gums for that. You really want to clear out, you want to make those bacteria have to move around. You don't want them to set up house in there. And so you floss under the gums. There's a little triangle. You want to go up the triangle, down the triangle. You want to clean that out completely. And then we brush after that, cleans out everything, and then we water pick. Water picking is huge. And so they're called water flossers now. There's all kinds of names for them. And it basically just a little tube with some water in a container, and you spray it around and you run around each of the teeth in there and you get everything out of that. And if you can do it twice a day, it makes the world a difference. And so I had a patient come in just last week and she said, "Thank you so much." She goes, "My gums always bled." She goes, "I thought it was normal." She goes, "I'm a different person now." She goes, "My gums don't bleed anymore. I take really good care of my mouth now." She's only in her 20s, and it was already causing her to lose bone. And so long term, when you don't take care of gum disease and it's just the bleeding gums, and then over time it becomes periodontal disease where the bone that's holding the teeth in place is affected and the teeth get longer and longer, and you see these people with long teeth, and then the teeth start moving because the bone isn't holding it in, and they have big spaces in between their teeth, and eventually the teeth fall out. They come in with them in a bag. They've got, "This tooth fell out of my mouth and here it is. Can you do anything with that?" And I'm like, "No, it came out because there's no bone left around there anymore." And it just got to the point where there's nothing left anymore. And then so it's a chronic kind of a thing. We watch mouths disintegrate over time. And I try and get people to a place where they're stable early on, where they've learned the mechanics of how to take care of themselves. Because as you lose a tooth here and you lose a tooth there, whether it's from gum disease or some other problem, you chew on the other teeth that are left. And now they become compromised. They're doing extra work. They're working super hard. And sometimes they break. Sometimes they shift in place and they move out of the way. Sometimes your bite gets confused and you're not really sure where to bite anymore. And so you're hitting something all the time and it's like a sledgehammer all day long. And now that tooth is loose and has to come out. Or that tooth has to be reshaped so it fits better into the profile of things. So there's a lot of balancing and a lot of learning. So sometimes I'll say to a patient when they first come in, it's like, "I don't really know you well enough to tell you exactly what to do. Let's just get to know each other a little more and see how much improvement we can see with some really good home care and some good hygiene learning, and let's see what things look like after a while before we say, oh, this needs to come out, this needs to happen, this is going to happen." So it's a bacterial process. I want to emphasize that. It's important. Sometimes the bite will actually impact the longevity of teeth, and we want to pay attention to that things as well. We'll go through the bite at another time because that's important for us. And we want you to know, like you need an owner's manual for your car. You need an owner's manual for your mouth. You need to be able to take care of it. And you need to know what to look for if it's not being taken care of. If your gums are swollen and red, there's a problem. If there's a big puffy spot that's always bleeding, it's a problem. So we use those three things. Those are standard in dentistry. It is not a holistic issue. It is just something that we emphasize in the office because we know that our patients really want to take care of things. They really want to be healthy, and this is a big part of it. So you think about the mouth. It is the beginning of the digestive tract. And we're throwing probiotics in here. So all the time, because we're trying to repopulate our digestive tract with healthy bacteria. But if we have pathogenic, sick bacteria in our mouths from gum disease, how are we impacting our intestinal health? How are we impacting our sinus health? How are we impacting all of this? So we breathe through our mouths and we eat through our mouths. There's a huge amount of bacteria that can be accessed in the mouth if it's not well cared for and it's not taken care of carefully. So we want to teach you how to keep things under control. Now, in the holistic practice, besides just having a water pick and besides that, we go through a lot of other devices and techniques. So there are essential oils that will help these things as well. There are products with essential oils that are wonderful. I don't believe that alcohol in a lot of the mouthwashes that are out there is a good choice. We have watched people actually burn their tissue with some of the alcohol products and some of the products that are out there. I'm not going to say their names because. And so we watch the gums, we can see like pieces of tissue just slough off. Their gums are peeling away from their cheeks and their tissue. And it's because of, I say, well, what kind of mouth rinse are you using? And they tell me, and I'm going, would you please stop that for a while and see if this resolves? Because some of these changes are almost precancerous. Anything that irritates tissue for a long time period can end up with abnormal cells forming in there. And so you want to be okay with some of those things. So the essential oils are lovely, and there are many products out there now that you can purchase that don't have alcohol in them, that have essential oils. You want something that's been tested and doctored. So they'll put bacteria from the mouth under a microscope and you can see them all swimming around, and then they introduce a particular essential oil and they can watch them disintegrate and die. And so those are the kinds of products you really want to start using. Now, some people make their own toothpastes. I don't have a problem with that. It works well. Some of the products that are very popular for the mouth include clove oil, which has been found, it's been centuries, because it's what the dentist office used to smell like was clove oil. It's the eugenol that calms nerves down and creates a quiet environment. So if I have a patient, for example, who's having a lot of sensitivity on a particular tooth, and they are really not anxious to take Advils and Tylenols and all that stuff, and it's really not going to help them, a little bit of clove oil will make all the difference in the world. Now, we explain to patients that a lot of these essential oils will burn the gums. So you have to be careful. So we ask them to either dilute it in coconut oil or olive oil so that it's almost a 1-to-5 mixture. So it's a drop of the oil in 5 drops of the other oil. So it's a dilute mixture. Or to take the clove oil, for example, and put it onto a cotton roll or a cotton pellet and just put it in the area. Very often that will do the trick. Some people will mix it into the toothpastes that they are making for themselves. The toothpastes some of them are wonderful, some of them we think will work well. One of the things that we used to use for gum disease years ago was baking soda and peroxide. It was mixed together in a slurry. They were told to use it once a day. It would kill the bacteria. And then I used to use this, even when in dental school, I used to tell my patients, and she came in 4 to 6 weeks later and she goes, it's so interesting. She goes, but my teeth are so much whiter now. So the peroxide, and you want food grade peroxide, and the baking soda had actually bleached her teeth. And it was then that they started coming out with bleaching products because they had figured out how to stabilize the bleach and the peroxide so that it was now a sellable product for people to bleach their teeth. But for gum disease, it's still an effective treatment. That's why they have baking soda toothpastes and all those other things. So baking soda and peroxide is also a nice technique for stopping the bacteria from taking over your mouth. Clove oil we talked about. Tea tree oil is another one. Also very caustic. You have to be careful not to burn yourself with it, but very helpful for certain, even the beginnings of decay sometimes will be impacted with some treatment by tea tree oil. Again, you have to dilute it. You have to use it very cautiously. It will burn tissue. It will irritate teeth. So you have to be cautious with that. So gum disease, those are some of the things that you can use to help treat it for yourself and to take care of it. The more you clean your teeth, the better off they do. And the less the bacteria can set up housekeeping in your mouth and really create more of an issue than you really want to have happen. So that was one of the issues, was gum disease.